All right, my name is Sara McCain, and I'm a nursing DUVO student, and today we are going to be inserting an IV. I've verified my physician order that this patient is going to get an IV, and I'm going to get started. Hello, my name is Sara. I am a DUVO nursing student. Today we are going to start an IV. Do you have any allergies to latex or any allergies that I need to know about? The patient says no, so I'm going to wash my hands. And I'm going to begin assessing for which vein I would like to use. So I'm going to tie my tourniquet. And I'm going to see which vein I would like. And it looks like I'm going to use this vein in the right hand. So I'm going to untie my tourniquet and get my supplies. So I've washed my hands. And I'm going to gather my supplies and put my gloves on. All right. I'm going to set up my J-loop so that everything is ready to go. Keeping everything clean. And I'm going to ensure that all the air is out of my J-loop. All the air is out, and I'm going to loosen the cap so that when I'm working one-handed, we are good to go. Cap has been loosened. All right, next I am going to tie my tourniquet. And I'm going to ask the patient to do a couple fist pumps, and I am going to begin cleaning the site for insertion. All around it, and I would do this for 30 seconds, and then I'm going to let that dry while I get my needle ready. And this is a 20 gauge needle, and all right, so I'm going to uncap the needle. And I'm going to get my bevel up, keep my bevel up. I'm going to anchor my vein. Tell the patient that he's going to feel a slight pinch. I'm going in at 30 degrees. I see a blood return, and I am in the vein, so I'm going to begin advancing my catheter. And I would advance it all the way so that the white is showing. And I'm going to retract my needle. I will put that in the sharps. Put gauze unders to stop any bleeding. I'm going to untie my tourniquet and hook up my J-loop. All right, I have removed my gauze. And I am going to secure this with a occlusive dressing. now that I have the dressing, I am going to flush to verify patency. And that is all set. And I have verified patency. I am going to label the IV with the insertion site, the date and time, and my initials, and then I will document that. I have removed, I have flushed. There's no evidence of infiltration, and at this time, I would either clamp the IV or hook it up to the pump and begin the IV. And then I would document that I inserted an IV in the patient's right hand vein, the date and time, and the patient tolerated the procedure well, and I will clean up my supplies. And that is it for IV insertion.